I want to build on what Dr. Means just shared, that these chronic diseases we face today, obesity, diabetes, fatty liver, all share something in common. They are, in fact, metabolic dysfunction. I'm going to go into a little bit of the science just to make sure we're all on the same page. Although most people think of metabolism as burning calories, it is far more than that. Metabolism is a series of chemical reactions that convert food into energy and building blocks essential for cellular health. When we have metabolic dysfunction, it can drive numerous chronic diseases, which is a paradigm shift in the medical field. Now, there is no doubt metabolism is complicated. It really is. It is influenced by biological, psychological, environmental, and social factors. And the medical field says this complexity is the reason we can't solve the obesity epidemic, because they're still trying to understand every molecular detail of biology. But in fact, we don't need to understand biology in order to understand the cause. The cause is coming from our environment, a toxic environment like poor diet and exposure to harmful chemicals. And these are actually quite easy to study, understand, and address. There is no doubt food plays a key role. It provides the substrate for energy and building blocks. Nutritious foods support metabolism, while ultra-processed options can disrupt it. It is shocking that today in 2024, the FDA allows food manufacturers to introduce brand new chemicals into our food supply without adequate testing. The manufacturers are allowed to determine for themselves whether this substance is safe for you and your family to eat or not. Metabolism's impact goes beyond physical health. I am a psychiatrist. Some of you are probably wondering, why are you here? It also affects mental health. Because guess what? The human brain is an organ too. And when brain metabolism is impaired, it can cause symptoms that we call mental illness. It is no coincidence that as the rates of obesity and diabetes are skyrocketing, so too are the rates of mental illness. In case you didn't know, we have a mental health crisis. We have all-time prevalence highs for depression, anxiety, bipolar disorder, deaths of despair, drug overdoses, ADHD, and autism. What does the mental health field have to say for this? Well, mental illness is just chemical imbalances or maybe trauma and stress. That is wholly insufficient to explain the epidemic that we are seeing. And in fact, there is a better way to integrate the biopsychosocial factors known to play a role in mental illness. Mental disorders at their core are often metabolic disorders impacting the brain. It's not surprising to most people that obesity and diabetes might play a role in depression or anxiety. But the rates of autism have quadrupled in just 20 years, and the rates of ADHD have tripled over that same period of time. These are neurodevelopmental disorders. And many people are struggling to understand how on earth could they rise so rapidly. But it turns out that metabolism plays a profound role in neurodevelopment. And sure enough, parents with metabolic issues like obesity and diabetes are more likely to have children with autism and ADHD. This is not about fat shaming. Because what I am arguing is that the same foods and chemicals and other drivers of obesity that are causing obesity in the parents are affecting the brain health of our children. There is compelling evidence that food plays a direct role in mental health. One study of nearly 300,000 people found that those who eat ultra-processed foods daily are 3 times more likely to struggle with their mental health than people who never or rarely consume them. A systematic review found direct associations between ultra-processed food exposure and 32 different health parameters, including mental health conditions. Now, I'm not here to say that food is the only or even primary driver of mental illness. Let's go back to something familiar. Trauma and stress do drive mental illness. But for those of you who don't know, trauma and stress are also associated with increased rates of obesity and diabetes. Trauma and stress change human metabolism. We need to put the science together. This brings me to a key point. We cannot separate physical and mental health from metabolic health. Addressing metabolic dysfunction has the potential to prevent and treat a wide range of chronic diseases.